In this video, we will be talking about hand expressing, why you might want to express, how the breast works, and how to express. We are going to talk through what works to make sure breastfeeding is effective and enjoyable.
There are many reasons why you might choose to hand express your breast milk. Maybe you are preparing and you're still pregnant and you're going to try and practice so that you're not learning a new skill when you're tired. You may be expecting some added challenges, such as a baby that may be separated from you, or if you have diabetes. It's also really an essential skill for all mothers to learn when they're breastfeeding. The World Health Organization tells us that we should teach all mothers, even mothers for whom breastfeeding is going really well, because it's a way of being able to care for your own breasts, keep your milk flowing, address any issues like blocked ducts or lumps that may lead to mastitis. I'm going to demonstrate to you using this knitted breast how to express your breast milk by hand. This is the technique that a lot of people find effective and comfortable, but you'll learn about your own breast and where the sweet spots are for you to get your own milk out. Try to be in a calm, quiet environment. Make sure that you've had pain relief if you're in pain and that you've used the loo. If you're feeling upset or uncomfortable, it can block the oxytocin hormone, which is the hormone that helps your milk to be let down to a place in your breast where your baby can get hold of it or where you can squeeze it so that it will express the milk. Start with a bit of gentle massage, and this can be any way that feels good to you. Stroking down the breast, using your knuckles and kneading the breast, and going all around and massaging your breast thoroughly. You can also include some touching of the end of your nipple, which will help to release oxytocin. Use your thumb and your forefinger in a C shape and place them about 2 to 3 centimeters from the base of your nipple, or an old-fashioned inch. It doesn't matter how big your pink or dark area is. It can be a bit of a red herring. Place your fingers in the C shape. You can push in towards your body and then close your fingers together as if you're trying to get them to meet. And release. You can build up a rhythm. It's really important to hold the squeeze for a few seconds because colostrum, the first milk, is very thick. It's a bit like squeezing a spot, and you need to wait until the colostrum comes to the end of the nipple. So you can build up a rhythm and keep going. Don't be worried if you don't see anything at first. It's the stimulation that's so important, so don't get disheartened. You may see only a small bead or a drop, and this may turn to squirts if you keep going. Even if you're getting nothing at all, keep on going and hand expressing frequently, and it will tell your body to make milk. You can, once the milk has stopped flowing in this position, move your C shape around so you're under the breast or on top of the breast. The breast is round and there's no right way up, so it's like a clock face. Our breasts have lobes which have all the milk producing cells inside, and so you can move around to see if you can find some different spots that work for you. When you've expressed this side and you feel that the milk has stopped flowing, it doesn't matter how long it takes. You can go to the other breast and do exactly the same thing, and you'll get more milk from that side. Once that stops flowing, you can go back to the first side, you'll get a little bit more. Then you need to think about how to collect your colostrum. You may have seen in the video that the mother is collecting her colostrum in a purple syringe, like this. It's quite tricky to work the syringe with one hand, and it's also not really very pleasant to have the syringe scraping on the end of the nipple. You can collect the colostrum in a teaspoon or any clean pot. Or the best storage place is inside your baby, and so you can hand express straight into your baby's mouth, and women have been doing this for centuries. It will help your baby to attach and tempt them to attach to the breast.